So I'd like to introduce our presenter for the day, or for the hour rather, Dr. Avi Ratnanason, who's the founder and CEO of Energesse. Energesse is the firm that specialises in improving patient experience and customer experience in healthcare through consulting, training and survey services. Dr. Avi's unique career began as a medical doctor in the UK and Australia, working across public and private sectors. He also has helped hospitals, primary care clinics, insurers, research organisations and primary health networks in the health sector to improve their strategy, consumer engagement and patient experience. Please welcome Dr. Avi.
Thanks very much, Sharon. Hello everyone, welcome to today's Patient Experience Masterclass. I'm Dr. Avi and I'm looking forward to sharing some information and knowledge with you in the next hour. So kicking straight into the webinar today, as Sharon mentioned, there is plenty of opportunity to ask questions right at the end. So feel free to put your questions into the chat box in the meantime, and we'll tackle them throughout the day or at the end of the hour. So I think one of the big questions that I get asked very often is, where do you start with improving patient experience? And this is quite a common question because it's a very confusing place right now. There's a lot going on in the whole space of patient experience. Pretty much there are a lot of surveys and survey technologies out there. There are people who are consulting in that space. And by the way, if you are joining the call or you're just joining the call, could you just mute yourself? Sometimes we can hear you during the day as well. So as I said, there are technologies, there are many different methodologies, there are lots of touch points in the patient experience. There are many different organizations. You could be a clinic, you could be a hospital, you could be a day surgery center, and all of this is requiring different forms or formats of improving the patient experience. So one of the things to then think about is, what's right for me? How do I actually improve the experience in my organization or in my department or in my clinic or ward? So this webinar will cover some of those elements, and it really is for two types of people. Number one, you could be kicking off your journey and starting that journey of improving the patient experience, or you could be someone who's already quite advanced, already started that journey in your organization. You could be collecting some feedback, and now you're more about trying to get more action from that feedback and increasing that improvement over time. So you really might be more at that advanced stage. So whatever stage of that patient experience journey you're on, my goal is that this webinar provides some value to you. Now, it's very clear over the last sort of 5 or 6 years, specifically specializing in the space of patient experience, that many organizations are very tactical. They start by trying something out without really having a goal in mind, and that leads to a lot of time wasted, a lot of money wasted, and a lot of effort wasted, and often that can result in big mistakes where patients complain or even take on lawsuits. So one of the things that's really important is to have a clear, structured strategy and methodology for improving the patient experience, and we're going to go through the 6E methodology today. The second thing is to really understand, where is your organization at in terms of its maturity? Without evaluating your maturity, you may choose the wrong solutions, the wrong resources, and spend money in areas that are not right for you in terms of where your organization is in the journey of improving patient experience. So we're going to talk about the maturity evaluation tool, and then finally we're going to talk a little bit about the solutions matrix as well, which is a matrix that actually helps you determine what is the right solution, whether it's the technology, whether it's a survey tool that is specifically catered to your organization in terms of where your maturity is at in patient experience, which then determines what is the next level of investment, of workload, funding, or resources for implementing the right solutions. So why are we an expert at this? Why do we have the right to even run a masterclass on this? Well, for the last 20 years, as Sharon mentioned, I've been in the healthcare industry, and specifically for the last 6, working with a whole range of organizations on improving consumer engagement and patient experience. That is from some of the largest insurers in the country, health recruitment companies, research organizations, to primary health networks in the UK, US, New Zealand, as well as particularly Australia and also Malaysia, and also working with hospitals, of course, some of the largest ones in Sydney, Western Sydney, Southwest Sydney, as well as private groups and so on. So we really have done a work not just with hospitals, but across the entire gamut of the health system. And that's because patients move from one service to another. They move from one organization to another to serve their healthcare needs. And my team and I have worked with various different facets of the ecosystem to help improve the experience along that patient journey. Our vision mission, therefore, is to really improve that health and well-being experience of 1 billion lives over the next few decades. And that's a journey that, you know, is continuing to progress over time. Now, what do we actually do? So we've got a combination of thought leadership, technology, and training, and I'll talk a bit more about that in terms of our consulting services, our ability to deliver platforms to implement surveys, and also we have training programs for leaders, management, and frontline as well. But let's get into what this is all about, or where patient experience or the importance of patient experience comes from. Well, some of you may already be aware that the Institute of Healthcare Improvement many years ago came out with a lot of research that health systems are going through this direction of not just improving health outcomes for patients, but also improving patient experience as a key priority for health systems. So every health organization now is looking at patient experience as a top priority, as well as looking at either improving their financials, whether that's improving revenue or lowering cost. And of course, we can't forget that you can't achieve all of this if your clinicians and your staff also don't have a good experience. So our research has shown that there's strong correlations between the patient experience and staff experience as well. So you have to actually look at this whole process holistically if you are going to make an improvement. Now, one of the things that really was a revelation for me after being a consultant in this space for about 4 years and being regarded as an expert I had this epiphany at a critical time point in my life where actually my dad became very ill. He was ill in another country and got admitted to the emergency department in Malaysia, and I actually had to fly back. Now, coming back to Malaysia, where I went into the hospital environment to basically look after him in his critical stage of being unwell, he was actually in a state of respiratory arrest, and the doctors actually had to move him into a intensive care unit. They had to put a breathing mask on his face. He couldn't breathe very well. He had IV lines, drips, and was connected to multiple lines and multiple machines. And you know, it was a very distressing point in my life. And in me looking at his patient experience, I was trying to think of what was the most important thing for him to stay alive. But at the same time, he actually looked at us as a family, and despite not being able to breathe, his primary complaint when he looked at us was he pointed up to the ceiling and says, "This room has no TV." And that was his biggest complaint, was that the room didn't have any entertainment for him. And which was really interesting for me at that time, coming from a clinical background and been in this industry and supposedly being an expert in this space, was that his primary objective, or his main goal, the real thing that was important to him from his experience, was what would keep him entertained, what would cater to his emotions. And that was really, really important, as in terms of flipping my mind of understanding. Even though I was an expert in this space, I had made assumptions about what he wanted in terms of his patient experience, even though it's someone I knew really, really well, it wasn't actually the most important to him at that point in time. And that completely flipped how I thought about patient experience. And so one of the things that I want to share in this presentation today is actually to talk about the fact that a lot of the root causes to challenges in improving the patient experience, and why we can sometimes waste a lot of time, money, and resources, is we have this perception of I know best. right? I've been working here for 10 years, I've been working here for 20 years, I know this hospital really well, or I know my clinic really well. And we actually become desensitized to what patients actually really want. So sometimes, if we've worked in the industry for a very long time, we can actually not know what's the right thing to improve that experience. The second thing is we sometimes work in silos, in that we can actually just focus on what's important for our department or our ward or our unit without actually understanding the other points of the patient journey. So you may be working on cardiology ward, but you may not know what's going on in the discharge lounge. You may not know what's going on in emergency. You may not know what's going on if you're a private hospital in the billing areas. You may not know what happened to that patient when he came from his GP. So that entire patient journey has transcended many different silos, yet you as a practitioner may only be focusing on one area and therefore not really understanding what that entire patient journey was for that patient. And one of the things I also find is that in medicine, traditionally, we always did a diagnosis before making a treatment. We would diagnose a medical condition and a problem before prescribing a solution. But in patient experience, it seemed to be the other way around. We would just go out and buy a solution or buy a survey or buy some kind of tool without really understanding where the maturity of our organization is at. What is it that we really need right now, and what can we actually handle? And often, I'm finding that a lot of the decisions around improving patient experience can be driven by cost, but not actually thinking about the cost benefit. So sometimes we look at buying what's the cheapest solution without thinking about actually which solution or which program is going to give us the best return on investment. So these then drive some bigger challenges then within an organization that we need to address. And I'll talk about how we solve this. So we've been working, as I said, with a lot of hospitals here. We've had a lot of good feedback around some of the work that we've done, particularly an article here that came out in Pulse IT around the work we've done with Western Sydney Local Health District, which is one of the largest group of hospitals in Sydney, where we've been collecting real-time feedback and helping them improve. And one of the things we found doing a lot of this work across many different organizations is there are three major critical success factors for transforming the patient experience. Now, of course, there are many success factors. There are many factors that affect whether you can improve the experience. But I'm going to talk about the three that I found to be the most important success factors that we found to be the major ones. If you don't tackle this, if you don't do this, I guarantee you will not achieve the results that you want to achieve in improving that patient experience. The first critical success factor is the lack of strategy. So I find that many organizations don't really have a strategy. They just decide, okay, we just want to start doing a survey without thinking about what happens when you do the survey, how are you going to use it, how is that going to translate into improvement? There's no clear strategy. So the critical success factor for me is you have to have a methodology and a strategy that is structured for how you're going to measure and improve the patient experience. The second critical success factor I found is leadership. And that is how you, if you're listening to this webinar right now, you are probably a leader in your own right. And what I mean by leader, I don't mean just the CEO. I mean could be a manager, you could be a frontline staff, you could be someone working in a clinic, you could be a cleaner in a hospital. Anybody that wants to improve the patient experience is a leader in their own right. And you need to have that confidence to assess, lead, and energize your culture, whether that's in your team, your department, your organization, to improve the patient experience. And I find that leadership is critically important. The third one is around understanding what are the right solutions to improve the patient experience within the budget constraints. So yes, money is an issue. We hear a lot that often hospitals are very constrained with finances, and it doesn't matter if I'm talking to a clinic that's seeing a couple of hundred patients a day, to hospitals and hospital groups that are seeing a few 100,000 patients a year. Budget always comes into it. And they often find that the argument for not doing anything is that we don't have enough budget. Well, there is always a little bit of budget around. It is more about how you utilize and optimize and maximize that budget and select the right solutions for your maturity of your department or organization. that is what counts. That is the critical success factor. So let's go into it in a little bit more detail. So in terms of a structure, how do you structurally improve that? Well, at Energesse, we've used a very clear structure for improving the patient experience. It is called the 6 E's, and I'll talk about the 6 E's in a minute, but essentially it covers a more holistic process of how to improve the patient experience. Now, why was this really important? Well, in all the years that I've been doing this work with my team, improving patient experience, we went through this process of really talking to a lot of clients and a lot of patient experience managers and patient experience leaders, and we kept asking them, well, what are you doing in terms of patient experience? And we said, oh, well, we run a survey. And I said to them, okay, well, that's great, and how much data are you collecting? And they would tell me, well, I'm collecting data from this department, that department, and so on. And I said, well, what do you do with the data? Oh, well, we produce reports. And I go, that's great. Well, what do you do with the reports? Oh, well, we share that with some of our stakeholders. And I said, okay, that's fantastic. Now, what do your stakeholders do? And they say, they discuss it. And I say, okay, and what happens after that? And there's dead silence. Now, this didn't just happen once. This happened over and over and over again. And what I found the best answer was for some people was that, oh, after that, we then do our next survey. And that was it, right? So all patient experience became was just doing patient surveys, reporting on those surveys. And once that was over, all their time was consumed with then doing the next survey. And no time was actually spent on the other parts of improving the patient experience, which was engagement and actioning and delivering outcomes. So this is the clear one big misconception in patient experience, is that measuring or surveying does not equal improvement, right? This is something that people need to realize. And therefore, you need to look beyond surveying alone. So I'm not saying surveying is not important. Understanding the patient experience, whether it's focus groups, interviews, and so on, is critically important. Surveys is a big part of that, but it's also important to look at the holistic process. Now, what is that methodology? Well, the 6 E's is firstly, E1 is experience, and that is how do you capture and measure the patient experience? That's E1. E2 is emotions. How do you actually analyze the stories and comments for pain points and delight? So really understanding the emotional pain points of those patients, whether that's analyzing the data and so on, is a critical piece. Next piece is engagement. The 6 E's involves having to actually engage your frontline staff with the data, with the feedback, or whether that's clinicians or management, to create or enable that change process. If you can't talk to your frontline, or if you can't talk to your leaders about the data and engage them, you cannot get them to move into executing a solution, which is E4, right? Execution is where you start implement strategies, or you perform service recovery actions. And what that means is, you know, if a doctor is rude, for example, to a patient, you immediately use that data, inform the doctor, say, hey, you know, patient has complained about you being rude. The doctor can then go and apologize about his tone of voice, because maybe it was not intentional. That's a service recovery solution. Other service recovery or other forms of execution is more quality improvements that are bigger projects that use methodologies like lean. And sometimes you can even involve policy improvements where, for example, some hospitals have restricted visiting hours, say from 6 p.m. to 10 p.m. And you may have got a lot of feedback that's too restricted. You can implement a policy change in your hospital to say, we're going to go to unrestricted visiting hours, which is an example that Kingston Hospital in Canada actually did. Finally, then you can actually measure your excellence. That's E5. That's how do you define success and accountability to KPIs, and then evolve and scale that maturity and repeatability over time in line with future trends in the patient experience. So that's how do you keep cycling year on year the evolution of your patient experience. So where has this worked? Well, in the we've worked with specialist clinics, and prior to the program of implementation, we've actually introduced in this group of specialist clinics, there was a chain of specialist clinics in the IVF space that wanted to be provider of choice, and they needed a clear strategy for improving that patient experience and identifying the gaps. They used the 6E structure to then actually understand and get buy-in as to what would be their first focus. Now, they did actually, and they were already doing surveys, but they enhance their surveys by introducing real-time surveys. So they actually wanted more rapid feedback, because that's the stage of maturity that they were in. They introduced workshops to engage staff, so they actually ran workshops with their staff, taught them certain techniques on how to act on patient feedback. And what they found is over a 12-month period, the Net Promoter Score actually increased by 15% over 12 months, which is a major increase in patient experience scores. So the process, if you have a clear structure and you know exactly what solution to put in place at what time, then you can achieve significant improvements in your overall Net Promoter Scores or patient feedback scores. The challenge many organizations have is that they introduce the wrong solution at the wrong time, and they invest in the wrong solution at the wrong time, because it's all about, it's too noisy. The world is now got a lot of solutions out there promoting things, and it's difficult. It's difficult to know what's the right thing to do at the right time. So having a clear strategy and using a clear structure will enable you to improve your patient experience over time. Now, the second critical success factor, which we talked about, is how can you, I mentioned leadership is critically important. So how do you as a leader confidently assess, lead, and energize your organization's culture? Because obviously this is a critical success factor. And one of the things to really realize after doing a lot of this work is that the will, the energy of the leader is fundamental to driving change and improvement over time. And one of the things to realize is that we as human beings, we go through a change curve. And this is an adaptation of that Kubler-Ross change curve, whereby we go through initially, when someone presents us with a change, for example, that, okay, your organization, your CEOs come out and say, okay, from now on, we want to improve the patient experience. Everyone starts to get them, oh, what does that mean? How much more work do I have to do? I'm already measuring so many things with safety and quality and governance. I can't measure something else. How do we have the money to do this? Oh my God, this is more work for me. And we go through this phase of denial. We start to get strong emotions. We start to get fearful. Okay, how might my job be affected? But then for those who actually go through that curve in a positive way, they start to accept that, yes, this is something I think is really important. I want to put patients first. I do believe in patient-centered care. I do want to improve their experience. And then you start to go through a realization of, I now see what I want to do. And then you become energized as a champion to not only want to improve that patient experience, but also help others do it. And that's when you grow, and that's when you start to achieve results. So it's really that piece of being energized, being motivated is probably where most of you are at now, and that's why you've come to the webinar. But you've got to realize that everybody else in your organization is also going through this kind of curve, right? And you've got to figure out, well, what's the right message to give to the people depending on where they're at on their emotional journey. And you've also got to realize your own change curve. But it's not only that, where is your organization's change curve as well? So this is a curve around the degree of commitment of an organization over time. And if you look at the degree of support for a change, initially, organizations kind of make contact or become aware of the need to measure patient experience. They start to understand it. They can develop a positive perception around it. And then they go through a process of experimentation. So trying out different solutions, different training programs, different experts, trying to do it in-house. And then going through a period of saying, this is now business as usual. We need to adopt it. We need to institutionalize it and internalize it. And this is usually the change curve of an organization, where they go through preparation, acceptance, and then fully committing to it. So what I find is, depending on where organizations are at, we can actually map that. And bear in mind, not everyone just goes up. Some go down as well. So some people, become aware, and you probably have come across people who are in this space where they become aware that they need to do something about patient experience, but they go into a negative state and become very confused. And some can, instead of understanding, can feel like, oh, this is all just a waste of time. This is not important. This is a trend that will pass. Let's not do anything about it. Let's go into inaction, reject any new initiative that comes in, and then try and terminate any pilots. that come out. So this is a reality that can happen. And so that leadership is really required to drive that change over a long period of time. And the truth be told, this can be 3 years, this can be 5 years, this can be 7 years. But if you don't start, you're never going to get there. And this is the thing that I tell a lot of organizations. Health systems are moving in this direction. The US health system is already attributing financial penalties and reimbursement based on patient experience scores. The UK health system is held all hospitals accountable to patient experience scores for the last 5 years. This is now happening in many other different countries as well. So my advice is to get moving, but understand where you are in that curve. But it's really important to also understand that it need not be expensive. Culture change need not be expensive if you have the right techniques in place, but also if you line up that behavior change with solving the right problems. Often we tell people, okay, well, you have to change, or you have to behave differently now. You have to smile to your patients. You have to introduce yourself. But we don't actually explain what's in it for them if they do it. We don't actually explain sometimes, well, if you do it this way, you know, not only will you feel more satisfied in your workplace, patients will also feel better. And guess what? We'll have less complaints, and you'll actually have more time with your patients as well, rather than be busier. So there are ways in which we can introduce that, and the literature shows that there are ways to do this. So one of the things that we've actually systemized and structured to help organizations do this is to create a maturity evaluation tool where you can actually map where your maturity is at as an organization. What are your measurement processes like? Where are your complaints processes like? How do you analyze data? And use the 6 E's to actually map your exact capability. That will then tell you where you're at as a maturity level, which stage you are. Are you at the limited stage? Are you actually at the stage 2? Are you doing things in an ad hoc manner? Are you more organized in stage 3? Or are you really managing patient experience? Or are you now stage 5 in that leadership phase? So we've actually got a maturity model that actually helps you identify very, very clearly exactly where you are on that change curve. And we do that with our clients to actually help them then determine what is the right step for you as a next step in terms of selecting the right tools, the right survey tools. Where should you do patient journey mapping? What are the biggest pain points? What are the solutions that you need to execute? But you do need to understand what your maturity level is at first in order for you to then select the right resources, tools, programs, and so on. So maturity evaluations and maturity models are very common. They have been used in other dimensions of healthcare. So for example, in patient safety, there's the Manchester Patient Safety Culture Assessment Tool that was developed in the UK. That had 10 dimensions at 5 progressive levels of maturity. And here's an example. There's also the HIMSS analytics, electronic medical record adoption models. For those of you who already have electronic medical records, your maturity from that perspective, there is a HIMSS staging around that as well. So maturity models in healthcare are very, very common, and also in the whole world of customer experience. This maturity model that we've developed is really specific for the patient experience. And this is really important because, you know, in the work that we've done, for example, with an emergency department, which we worked with in South Australia, they had a lot of desire to improve quality and services and manage the patient volumes that were coming through. But they found that by using a maturity model, they found that they were at stage 1. They were limited in terms of the measurement that they were doing and the maturity spectrum, and therefore the maturity model helped them perform, in a sense, like an audit, and in order to understand which key patient experience issues needed to be identified and addressed within the financial constraints that they had. And what they actually did was a whole restructuring of their care model in emergency to be more patient-centered. And that then identified that they needed to do a bit of patient journey mapping, extending some of their surveys to add new questions to their experience surveys. They also had methodologies to engage staff and actually solve some of the bed block issues that were happening in the hospital. And the result for that CEO of that emergency department who went through this process actually then managed to get his contract renewed with that particular hospital, which he was very happy with because it was a long-term engagement, and we managed to do it within the budget, as well as developing a new model of care for emergency within his organization, which the hospital was very, very impressed with. So it's really, really important to understand your maturity and then do the right things to make a difference. So one of the things that we advocate is that, you know, a maturity evaluation should be the first step to clarify your objectives, your maturity stage, the cultural constraints, and the resource gaps as well. Now, it's okay if you already have surveys in place, if you already have training programs in place, and so on, because the maturity evaluation tool will then help you evaluate how far that has gotten you and what are the new and existing gaps around structure, accountability, internal sponsorship, resource constraints, and so on. So everybody's on a different stage of the journey or different stage of maturity. Now, the third success factor, as I mentioned earlier on today, was now that you understand your maturity, how do you utilize or select the right solutions that will improve the patient experience within your budget constraints? Now, we all work under specific budget constraints, and you know, it's often, I find, almost an excuse as to not to do something. It's often a reason not to do any kind of improvement. And it's important to understand that the experience, the problems in the experience sometimes can be solved very, very easily. I mean, ask yourself, what is the cost of a smile? How much does a smile cost? It costs nothing. Yet sometimes, if you can get everybody in your organization to smile, or if someone's feeling down and they're having a bad experience in your hospital, they're feeling like they've been waiting too long in the queue, or they've been waiting for their medications post-discharge, and they've been very frustrated, coming in, listening with some empathy, smiling, cheering them up a little bit, can often turn things around. So not all the solutions need to be big and expensive and technology. Some of it can be very, very simple. And so it's really, really important that despite whatever budget constraints you have, it's not about your resources, it's about resourcefulness. Okay? It's not about your resources, it's also about your resourcefulness. So how resourceful are you? And we have a very great example, actually, which occurred in Malaysia from one of the hospitals that came to our 6E training over there. And they had this big problem where they were undergoing renovations. And I'm sure if you work in a healthcare organization, at some point your office, your organization will have some renovations going on. And they were going through some major renovations in their hospital. And this was a big sort of change for them in terms of an improvement or upgrading of their services. But during that renovation process, they had to close down their cafeteria. And that was, and so when they started running their patient feedback surveys, what started to pop up, not surprisingly, was that patients were starting to say that, you know, it was very difficult to get food because there wasn't actually many eateries that were close by to the hospital, and therefore patients were actually waiting for a while in the queues, and they were getting hungry, and there wasn't any easy access to the food. Now, here's the trick. Immediately, many people will go, okay, well, that's a problem. How do we set up a cafeteria somewhere else, right? And you start to think of these big solutions about, okay, maybe we can set up a cafeteria here, maybe we need to knock down another wall, bading, badoom, and we're always thinking of these big, expensive solutions. Now, the people at this organization, which was Bagan Specialist Center, used the 6E methodology and used it very, very creatively. After doing E1, which was measuring the experience, and E2, understanding the emotional pain points, they engaged their teams, which is E3. They had conversations with their cafeteria staff. They had conversations with the patients. They had conversations with their other frontline staff. And they went into E4 execution and worked through a development of a solution, which was a mobile food cart, a very simple idea. And what they did is they took a unused trolley in the hospital, which was a drug trolley, a very typical trolley that you can see on the left there, and they converted that trolley into a mobile food cart. And the engagement was so good that they even involved their dietitians in the hospital. So dietitians selected healthy food to be sold on that food cart, as well as, you know, some of the other common foods that people had. And as a result, they not only were able to convert the cart and put food on it, but they were able to bring it to patients at different places in the hospital, which then made the food experience even better for patients. And they actually measured their sort of patient feedback on the fact that they had no cafeteria, and they actually reduced the number of complaints and negative feedback by 10% post the initiation of that food cart. But not only that, they were able to generate revenue from selling the food on the food cart as well, where all that revenue had stopped because the cafeteria had closed down. So this is one of those, and obviously staff were very happy as well because the patients were happy. So this is one of those examples where it didn't cost very much at all, because they'd used a resource that actually already existed in the hospital, converted that, used the 6E methodology, and were able to achieve the quadruple aims, which is improve the experience in a measured way, improve staff experience, improve their cost equation and revenue. And of course, but you know, we don't know whether health outcomes were improved. They didn't measure that, but the dietitians were involved in selecting a lot of the food on the food cart to choose to make healthier food. So this particular project from Bagan Specialist Center in Penang in Malaysia won the Energesse Malaysia Patient Experience Award as well. So congratulations to that team. Now it's a common occurrence when we actually use this strategy. We also had another client, which is a local health district, that needed more meaningful insights from the system, from their surveys. They were at the ad hoc stage. They were had staff doing surveys in different hospitals in different formats. They had no consolidated way of consolidating all the data around their surveys. And what they then decided to do was actually look at, actually create their own solutions matrix, compare different solutions, understand what the best practices were, and articulate a clear vision. And they also managed to see an increase in their patient experience scores. They managed to acquire a solution within the budget. They actually then started to escalate their patient experience scores, not just from an executive level, but having a standardized methodology for collecting patient feedback allowed that metric to be escalated to the board as well. And that future direction is to look at going from, you know, that organized approach to then becoming managed. So improving their maturity in that organization over time. And this occurred at a health district in Sydney. So how do you get there? Well, one of the ways to do that is to actually have a solutions matrix, and we do this for our clients, where we actually help you look at different solutions, help you compare different solutions, and actually understand what are the right ones for you and what are the right capabilities to choose within the budget that you actually have. So a solutions matrix can help you match the right solutions for the right budget at the right time and for the right resource constraints that you have. So recapping those 3 major critical success factors that you should think about in your organization is, how do you improve that patient experience? You've got to have a clear strategy and a structured improvement methodology. You've got to be able to confidently change your organization's culture, whether that's your team, yourself, but also your organization. It's very important for you to have that leadership and that approach and understand how you can change that culture over time, and also then finally selecting the right tools, solutions, or resources within the budgets and the maturity of your team and your organization. So I'm just going to stop there at the moment, because I just want to ask, how are you feeling right now? Some of you might feel like, oh geez, this is an information overload. And I did say at the beginning, there's a lot of information we had to cover. You might feel like you're drinking from a fire hose. Well, one of the things to, I suppose, reassure you about is there's many ways that, you know, we can help you, and many ways that you can sort of help yourself. So one of the things we do is we actually do training workshops to actually help leaders in the space build capability, either with frontline staff, middle management, or leadership around patient experience. These tools are also available to actually help you map your maturity to evaluate your organization against maturity model, and to select the right tools for you. We also, with a lot of our clients, have a change management program that actually helps you have strategy sessions. What is the strategy that you're going to implement? What's the right strategy for you right now? And how do you actually create change in your organization? How do you engage your frontline staff to take action? How do you even engage your leadership to take action as well? Some of our tools also includes the solutions matrix, which actually maps all the different technologies that are out there for surveying, for entertainment, for various different bits and pieces. We're also now partnering with organizations like Apple as an authorized service provider, and actually can help you work through the entire ecosystem of technologies that exist to improve patient experience. Finally, we also have that patient experience community. This is a group on LinkedIn that you can join to actually help you understand and connect with other practitioners in patient experience. And last but not least, we also have a roundtable event in Sydney on the 12th of July. The tickets, I think we still have a couple of tickets left for those of you who are Sydney based. This is happening soon, where we're bringing together a group of 30 to 40 healthcare practitioners and champions around the country to brainstorm different ideas on how to actually improve patient experience, share best practices, connect and engage on the knowledge and networks. So some of the workshops that we do are open workshops. We also do in-house workshops where we go to hospitals or clinics and deliver the workshops there. As I've already mentioned, the roundtable, and we're also starting to introduce online training programs as well. So if you have questions about this, a lot of this is around the 6E methodology, as I mentioned, where we actually teach you the methodology on how to measure feedback, how do you run the surveys, what are the right questions to ask, how do you analyze the pain points, the change management around engagement, also execution, what are the solutions, how do you do reports, and how do you measure excellence, how do you introduce KPIs, and how do you introduce the sustainability and introduce a more model of, you might have heard of, say, total quality management, and you can see that these sort of cycles are very similar to PDSA, or you might, if some of you are familiar with Planetree, they've got their models around this as well. So this really helps you synergize and put some of those practices in a very practical sort of way. And also select the right solutions for the objectives that you want to achieve and the trends over time. So to recap what some of those tools are, there's the maturity evaluation tool, where you can evaluate and determine what's the right, where are you at in terms of the maturity and the capabilities across measurement, analysis, staff engagement, staff experience, and solution execution, so that you can obtain the best return on investment for your organization. Map your maturity model against the different stages, as I mentioned before. Understand where you're at in that maturity model and what some of the right solutions are. It's also really important to understand that your maturity on the measurement side of experience can be different to your maturity on analysis, can be different to your maturity on engagement and execution, and so on. So, your stage can vary depending on each of the E's that I mentioned. And finally, it's also really important to select the right solution. Maybe you want to do real-time patient feedback, maybe you want to collect patient stories, maybe you're looking for entertainment systems to improve the experience. It's important to do that diagnostic piece, as I said, before you go into the treatment piece, right? Do the diagnosis, understand what your maturity evaluation is before you go into the diagnosis. This is that patient experience community that I talked about earlier. It is a group on LinkedIn. It's over 200 members now. So please go into this group if you're a practitioner or a champion of patient experience. Add yourself to this group and ask any questions that you have, and hopefully one of the group members will help you with some answers. And of course, introduce yourself when you join the group as well. Some of you may be thinking, okay, well, Avi, this methodology seems like it applies to hospitals only, but that's not really true. It does, the 6E's methodology and maturity evaluation can be used for acute care facilities and services like hospitals, primary care, primary health networks, specialist services, daycare hospitals and procedures, allied health, such as pharmacy, dietetics. It doesn't matter if you're public, private sector, or unit ward, or not-for-profit, aged care or disability. All these areas need to improve the experience. Sometimes you may be a transport or auxiliary service or a mental health service as well. This methodology can apply to all of those. So you might be thinking right now, what do I do? Well, really you have two options. One is do nothing. Do nothing different. Keep doing what you're doing. The second is test out the methodology and see if it works for you. So my invitation to you is, what do you need to do next? We are offering at the moment a free 30-minute conversation with either myself or an Energesse specialist, where you can actually discuss where you are in the in your journey and what your needs are. And we'd be happy to help you determine what's the right way for you to go, what's the right solution or training or program, or just provide some free advice as to what's the most beneficial item for you. I'd encourage you to start your journey with the right experience. Right now, Olivia will be entering those contact details. So this is a link. I'll just go back to this. This is a link where you can click on and you can organize that, that appointment with either, as I said, myself or one of my Energesse specialists. Alternatively, email Olivia or call her on the phone number to make that appointment. Here are some of those options, again, that are available. As I mentioned, we do the training workshops, the maturity tools, the solution matrix. We also help organizations with change management around implementing new technologies and realizing outcomes from that so they get a better experience. I talked already about the community, but also we do real-time patient feedback and various different kinds of survey platforms depending on the budgets that you have, and either that will come from some of our partners that we work with, but some organizations struggle with survey design and implementation, so we help with that. We do strategy sessions, and I've talked about the roundtable as well. So finally, I'd like to end there. Thank you very much. I hope that was useful. Please provide us with some feedback at the end of this. And it's now time for questions. Please feel free to stick your questions into the chat box, as was mentioned earlier. And I also want to mention that the roundtable is being held at the Westmead Hospital in Hawkesbury Road, and Sharon, our patient experience specialist, has entered the details in the chat box, and Olivia has also added the free consultation link in the chat box as well. So if you don't know where that is, just go over to the right. You'll see a drop down for chat. Click on that, and you'll be able to see a some opportunities, link there. So if you have any questions right now, now's the time to ask them. Please feel free to type them into the message box, and I'd be happy to answer those questions as well. So now's the time. Please feel free to jump in and ask your questions. Give it a couple of minutes. Let's see if we have anyone coming through. Questions? Okay. While we're doing that, I'm just going to put that slide back up again while we're waiting for the questions to basically run through again. What are all the options available? As I said, it can be a crowded space. It can be a confusing space for some people who are either kicking off their journey around patient experience, or you've been doing it for some time and you're really not sure what you need to do next. What do you need to pare back? What do you need to stop doing? What can you start doing? What do you need to tweak, and how do you need to tweak it in order to get the outcomes that you need? Also, if you have questions or ideas for other things that you want to learn, other solutions, or you want some training or webinars on different topics, please feel free to message us as well. My email address is there. I'd love to hear from you on what are the problems that you're currently challenged with, that maybe you need a bit of help with, but you're not quite sure what it is. So I'd love to just hear about, either with me or my team, where you are at the moment in your journey of measuring the patient experience, and what you feel is either a challenge or an opportunity that you want to explore moving forward. So we still have a little bit of time. If there are no questions, we may end slightly earlier. And just to wrap up then, whilst if no one has any questions, just a few things to summarize. So what will happen after this is that this link will get sent to you for your benefit. Please feel free to share that with your colleagues as well. You may have a, say, your manager, supervisor, CEO, or boss, or other colleagues that are interested in this space. Please feel free to send them the link if they want to have a chat with one of the team. You know, we're available to do that. Or if they want to email us, we're available for that as well. Alternatively, we also have different ways of supporting different kinds of organizations. And I actually have one question come here from Jagadesh. Thank you for your question. As one of the healthcare call centers, we would like to know how we can apply the 6E method to our environment as well. Well, that's a very good question. Call centers also go through the similar process. So it needs to go through a process of data collection and collecting feedback from people calling on the phones, and there's various different technologies for collecting feedback from call centers specifically. Some of these are recorded, some of these are voice recorded, but then it's also that process of then reporting on that feedback and identifying what those specific issues are, how you solve them, and how you translate that into improvement. So definitely the 6E methodology can be applied to healthcare call centers as well, and I'm happy to sort of take that conversation offline to talk about it a bit more. It's funny because that idea, that problem just came up in another client as well in the health insurance space. So I'm happy to chat through the details of that offline, Jagadesh. Thank you for that question. Are there any other questions as well? No? Okay. You're welcome, Jagadesh. Well, if there's no other questions, then you know, I think we can end a little bit earlier. And as I said, this email, the recording will be sent out as well. Please free to forward to your colleagues. Thank you very much, everyone, for your time. As I said before, please feel free to click on the link if you'd like to have a conversation that Olivia has put in the chat box. And have a great day. Love your journey, live the experience, make a big difference in your organization, and by all means, don't give up. Thank you very much. I'm Dr. Avi. Bye for now.